Hello and good evening to all the viewers of Scube TV. Guys, today I have with me a very special guest. His name is Dr. Chand Sawhney. He is a dentist and also an orthodontist. Dr. Chand, welcome to our show.
Hello.
We are, yeah, hello. Yeah, so, we are going to ask him many questions. He is a dentist, so I know that the common people have a lot of things to ask about teeth and, about dental hygiene and all these things, because we normally tend to ignore these things. We tend to take care of our body, but we actually sometimes forget that what is important. I mean, in the terms of oral hygiene and dental hygiene. So we are actually going to talk about that today. So Dr. Chand, welcome to our show once again. It's a pleasure having you on our show, and I'm hoping that it is going to be one of an amazing episode. I've already, yeah. So, like I've already introduced you that you are a dentist and also an orthodontics. If you yourself can introduce yourself to the audiences, and if you can tell something more about you.
Yeah. Hello, everyone, and hi, Rajni. Uh,
Hi.
uh, 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 I have done my undergraduation from Manipal College of Dental Sciences, Manipal, and my post graduation is from Manipal College of Dental Sciences in Orthodontics. I have very much special interest in correcting irregularity to a regular shape. I can say it's my hobby now, and I do lingual, Invisalign, all from of orthodontics, besides general dentistry at my center, along with my wife in Agra. Uh, I think
Okay.
we can start the interactions now, and I hope all the viewers will be benefited with this interaction.
They will be for sure. Like you have told something, like you have told about this thing about yourself, that you are, doing this thing, and you like to shape irregular things into regular things. So, I mean, that's amazing. And also with this, if you can tell, how did you thought of going into this particular field, and why did you actually chose this field to be your career? Why not something else? Were you
Uh,
studious in your school days or in your college days?
I think I was average. I'll not say
Okay.
I was very studious. I was average, and then since I prepared for medicine and I got the seat in Manipal, and then the journey has started. And then you develop interest once you do something, and then keep on developing your interest. It expand your horizons, your thinking,
Yeah.
and then you try to do some attractive things. And yes, it is I am doing it for my livelihood, but yes, it is benefiting others also. So that I think it is a good profession.
Okay, of course. I mean, you're taking care of something that makes a person look even more beautiful. I mean, teeth are something that makes a person look beautiful, and the smile makes a person look so happy and so beautiful. And of course, that is an amazing job that you're doing. Okay, with this, I would also like to ask you another question too. That we normally take care of our body. So we every day we have this routine that we do, and that we follow actually. That we wake up in the morning, and then we get fresh, and then we take a shower, and we brush our teeth, and then we take our breakfast, and this is actually a normal routine for our body. And if we sometimes fall sick, so at that time, there is something that we have to do exercise, we have to take medicines and all these things. But now I would like to ask you that what should be our routine for our teeth, for our dental hygiene, for our oral hygiene? What should be our routine that we should follow on a regular basis? If you can tell something about that.
Uh, yeah, that's a good question actually. We do exercise, take good food for our general hygiene. Again, everything which we eat, it goes through mouth to your stomach, and
Yeah.
like it is digested. All the things are there. So mouth has to be healthy. Your entry point has to be fine so that you had a smooth ride. So
Yeah.
everybody should brush their teeth at least twice a day.
Okay.
Secondly, use mouthwash, especially if possible, hexidine-based mouthwash. If that is not available, you can use warm saline gargles at least twice a day, because saline also make your mouth pH toward basic. So once
Okay.
the pH will be neutral or basic, the bacterial growth will be less. When bacterial
Okay.
growth is less, you not easily tend to develop the dental problems.
Mm-hmm.
So these are the things. Besides this, for your gums health, try to have good amount of vitamin C, lemon, oranges, no,
Okay.
these things in your diet, because healthy gums is a healthy foundation for your teeth, and vitamin
Mm.
C is very essential for it. So try to have good amount of vitamin C.
Okay. 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 So you're saying this is the, I mean, this is the routine that one should follow for,
Yeah, yeah,
you know.
yeah.
Okay. Okay. Amazing. With this, I also would like to ask. Yeah. You're saying something.
Yeah, like warm saline gargle is something which is available in every kitchen. So you don't have to go for something very special. You can just
Mm-hmm.
have little bit enthusiasm to do this at least twice a day.
Yeah, true. I mean, also, with this, I've also heard, while talking to people, the number of people, the number of mouths, the number of talks that we have. So, while I was talking to some people, so I actually came through this thing that some people were saying that, one needs to brush their teeth after having their breakfast. In today's time, this should be the routine that after you take your breakfast, then you should clean your teeth or brush your teeth. And so, I mean, would you recommend that? And would you say this should be the way to do it?
Yes, there is a way to brush the teeth, and you can you brush like you routinely do. Once you get up, and then before taking bath, we usually brush our teeth, and that is
Yeah.
the thing we followed. After taking breakfast, what you can do is you can use mouthwash or warm saline gargle actually to
Okay.
flush up little bit deposits which are get sticking on your teeth and gums after the breakfast. So you can do gargles at that time. And before going to bed also, you after taking your dinner, you should do brushing.
Okay. 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 Yeah, of course. So, also, I would like to ask you that, we are actually going through this phase when, in kids at an early age, they are having, these teeth problems, and they're having this cavities, and, and a lot of problem with their teeth, and with their jaws. So what actually are we doing wrong, and what actually we should do right to take care of, our oral or dental hygiene?
See, you can divide the problems which a child faces, or which can turn into a gross problem in teenage or a later adulthood, in two parts. One, which can be avoided while maintaining good oral hygiene: cavities, decay tooth,
Mm-hmm.
and the gums problem, all these things. So by maintaining a good oral hygiene, you can avoid these problems. Now, second is irregular teeth, or
Yeah.
you, the teeth are basically encased in the jaws, upper and lower jaw. You
Mm-hmm.
sometimes you see that the a small 10-year-old girl or boy, it has a protruding maxilla, upper jaw. Maxilla is the upper jaw. The front teeth are protruded; they are forwardly placed. And sometimes we also see that the lower jaw, that is mandible, the teeth are forwardly placed. So that look ugly. So we have certain therapies, functional appliances, which if we introduce them at early age, say we say mixed dentition age, around 9 to 10 year of age, then we can
Mm-hmm.
correct this jaw deformities, which at later age, I again repeat, which at later age, that is once the child reach adulthood, required a surgery. So that can be avoided if you have got a correct orthodontic treatment at an early age.
Okay.
Secondly, for irregular teeth, all the cases don't require functional treatment. Normally, braces can treat, I think, 75% of cases. Now, beside aesthetics, that is the looks, it also has an functional and stability importance, because if teeth are forwardly placed, protruded, the children are more prone for trauma.
Mm-hmm.
You have seen, like, the children which have their front teeth forwardly placed, they sometimes encounter that, yeah, this teeth is fractured in my childhood. Once you ask a history, so these episodes can be definitely avoided. Beside this, the teenage peer group rejection some children faces because of the ugly teeth or looks, which has a very high psychological impact, I'll say. That trauma, psychological trauma, will also be avoided. So it has many advantages, not only aesthetic but functional also. And then a good dentition, you can brush easily. If they are irregularly placed, it is difficult to brush. Again, it's like you buy a BMW, but if road is not proper, it will not
Yeah.
give you joyride. So if they're well aligned, they're pleasing, it is easy to clean, uh, you look smart, because first thing which we see in anybody face once we see is a smile, then come the eyes.
Yeah.
69% of the people notice the smile. So
Yeah.
uh, a good smile tell million of words.
True that.
So it is very important, and if somebody has good smile like you, then yes, it is very pleasing.
Thank you. Thank you so much for the compliment. But and you yourself have a very good smile, and of course you are a dentist. So I mean, the first thing that the customer, if he comes to you, if your client comes to you, or the patient comes to you, so he obviously must be noticing your smile, and only then he must be coming for the treatment. I would say this. Okay, so you have told this amazing thing about all these about the oral hygiene and dental hygiene, and what measures should be taken at an early age. But also, I would like to ask you that there is this thing that when people have this problem of teeth problems, and these cavities, and they go through these pains, so they normally, what they do is they go to their kitchen for some dadi nani ka remedy and home remedies, and they tend to use those kind of things, cloves, or all these things they actually tend to use to reduce the pain, and to reduce the problem that is going on with their teeth. So would you suggest that, is that okay for them to do?
Actually, teeth, if cavity is there, it has to be treated. If it is
Okay.
superficial or at an average depth, it needs to be restored with some good filling material. Whereas if it has reached the nerve, then it has to be properly clean. Nerves, infective nerves should be clean, and RCT should be done, followed by restoration, includes crown. As far as your home remedies are concerned, they are just a temporary measure to pass some difficult time in emergency, but otherwise you will not have any relief even with the medicines. They are the
Okay.
temporary solution to relieve pain. There are many methods. You can take some painkiller or clove, all these things you can use, but permanent solution, because there are chances of subsequent infections also, some swellings, and then more problems, is go to your dentist, visit your dentist, and get them corrected. Once a cavity is there, it has to be filled. If it is deep, the RCT should be done, and then the subsequent crown should be given. That is the only solution. And yes, we should save our teeth, because most of the time we work judiciously to get a good livelihood so that we can eat good food. But many times we have encountered this thing that you can't eat properly, and then we
Yeah.
have to do dental implants, fixed dentures, all these things. So if you can take care of your teeth at the appropriate time, and you can get the appropriate treatment at appropriate time for cavities, yes, your teeth will work nicely, and there is nothing like the teeth which are given by God.
Of course. Yeah. True. Okay. And also, I would like to ask you that what are the steps that we are taking wrong, or that we are doing wrong for our teeth? You must have come across the kind of cases that the people must have told you that I actually did this, or I actually did that, and something happened wrong, and something went wrong
Basically,
with my. Yeah, yeah, yeah.
yeah. basically thing is that it is general habit of patient, like some pain is there, you take some medicine, pain is relief for a few months, and just we are okay. Then again some
Mm-hmm.
swelling has come, sometimes people take antibiotics themselves, and then it is relief. But once they come to us, uh, the story is about to be over. So many times we have to do extractions or complicated bridges, RCT crowns, sometime
Yeah.
with also. So once you have problem, reach to your dentist. The treatment will be less, I will say, intrusive, less intensive, less costly
Mm-hmm.
also.
Mm-hmm.
And more late you go, more intensive treatment you have to take, more expensive treatment you have to take, and more painful procedure might be done. Because
Yeah.
yes, cavity, you go to your dentist, he will fill it. But you go late, then root canal
Mm-hmm.
treatment will be done. So there are many advances now. We ourselves do single sitting root canal in our centers, and then very good crowns are available. Even if you are late, now there is no tooth structure. Then we have to extract that tooth, and then we have to put fix implant. Again, it is a routinely done surgery nowadays. If somebody don't have teeth, we can
Yeah.
place teeth also. But if you have, please respect those teeth.
Okay, okay, of course. And also I'd like to ask you that, people also go for whitening their teeth, and if they come across, if the teeth are getting yellow, or if they are going through those kind of problems, so they don't normally consult the dentist. But what they do is they directly go for the treatment, and they directly go for teeth whitening. So would you say, is that a right thing to do? I mean, would you suggest that? And also, does it have any side effect?
See, teeth whitening is not basically it is a routinely done procedure in a dental office called bleaching. But
Okay.
it is not successful in all the cases. We have to see what is the prime defect.
Mm-hmm.
If, if they are yellow, mild yellowish color is there, yes, we can get a better color. And there is a proper way to do bleaching. It has to be done by a professional to
Mm-hmm.
maintain the integrity of the tissues and to didn't have any side effect. But
Mm-hmm.
in case you have a brown spots, fluorosis is there, it is not effective. Then you have to go for veneering. So bleaching is not successful in every case. There are different strokes for different folks. So yes, it works. Bleaching works, but not in all the cases. You have to consult the specialist, and going on the doctor advice, the subsequent treatment has to be done.
Okay. 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 All right. So also, if you can share one of your cases, one of your interesting cases that you have come across, and you actually treated. Do you have any such case of yours in your mind right now that you can share with the audiences and also with me?
Uh,
The most interesting case of yours. Let's talk about that.
uh, right now, routinely we do many cases, but I remember while I am doing my post graduation,
Mm-hmm.
like it was a wow moment. Since you were resident, so you don't select cases. The cases at that time in 2009 were given by our teachers, our superiors. So I was doing a case of a 39, 40-year-old lady. So she was very much tactical for getting braces. And she was not very much convinced that her forwardly face and the gap between the teeth, all these things will be corrected.
Okay.
And grace of God, the result was fabulous. And
Mm-hmm.
I was very much appreciated. And then she refused, I will not name, uh, uh, for her daughter. Like she has very much irregular teeth, and uh, a case was taken by my senior at professor
Okay.
teacher. But she insisted that Dr. Chan will do that case of her
Oh,
daughter.
okay.
So that was a wow moment for me. Yes, like again, a girl was a medical student, first year MBBS student. So yes, once somebody come with that much appreciation in your starting days, then they act as a morale booster. And many times in our clinic, we encounter many cases like patient has they didn't have courage, I'll say, to smile. Uh, they are like psychologically depressed because of the
Yeah.
ugly looking irregularity. Many times somebody is going to get married in near future, and when we changes a protruded face with nearly normally aligned face in few months, so and then they come with yes, some success story or some good news about the marriage and their social relationships, and that's I am happy that I have contributed in somebody's personal life or professional life.
Okay, amazing. Amazing. And also now let's talk about, a bad breath. I mean, this is a very common problem in a lot of people. So, what happens is people don't normally, if you are actually talking to a person, so that person might not actually know that they're having this problem. And, the one talking to the person would also, it would be a bit, I mean, we wouldn't like to humiliate the other person, or it would feel like a humiliation, or a very embarrassing kind of thing, that if you'll talk that you have a bad breath, so we can't directly say that to someone. And also, if someone also is talking to us, so if we go through that problem, so one normally doesn't know about it. So what are we doing wrong in that case, and how should we treat it? What should we do right for it?
See, bad breath is because of the plaque, which is basically collection of millions of bacteria.
Okay.
Okay, white plaque, white substance near teeth and gums. So that means your teeth cleaning is improper. In that case, should judiciously brush your teeth, as I suggested earlier, twice a day. You have to use a hexidine-based mouthwash twice a day because that
Would you suggest would you suggest something, some brand or something that is available in the market or something like that?
I'm saying the salt, hexidine-based my mouthwash, anything you can go for.
Anything.
Any brand, all
Okay.
brands are fine. Explore hexidine-based mouthwash. But most of the cases, when bad breath is there, you need professional cleaning. That is called scaling by the dentist. So you
Okay.
have to visit your dentist. He will do this necessary scaling, and then you will continue with the mouthwash for a few weeks. Maintain then proper oral hygiene. Keep on brushing your teeth, flossing, and then you will notice the change.
Okay. All right. All right. Perfect. And if you can talk about food, that what kind of food should we have, and what kind of juices that we should take, for a better dental hygiene and oral hygiene.
So, see, you can eat everything provided you have teeth. But in general, I will suggest you can again you eat everything. But only thing is that cut your sugar intake. If you're eating something which is sugary, which is sweet, don't eat frequently in time. Like in 5-6 times in a day, don't eat sweet things. Okay, cut the sugar meals in your diet, and once you take this sugary meal, try that you are doing brushing after 1 or 2 sugary meals, or you take some gargle. No, it should not reside in your mouth again. Then it attract bacteria. Sugar is a food carbohydrate. The raw carbohydrate is a food for bacteria. They are processed, basically processed carbohydrate, so they are food for bacteria. So
Okay.
sugar intake, especially the frequency of sugar intake, should be less.
Okay. Okay, so you're saying it is also, as it is unhealthy for the body, sugar is unhealthy for the body. Same is in the same manner, it is also unhealthy for the mouth as well.
Yeah.
Okay, all right. Also, if you can tell something about the remedies, if you can talk about cavity, actually, we have actually got a question about if you can talk about more about cavity and how to cure that.
See, cavity basically is the decalcification. The tooth, it is a highly calcified substance in our body. It has around 95 to 96% of mineral content. Okay, so
Yeah.
Cavity because the these minerals are binded by cross
Mm-hmm.
linking.
Yeah,
Hello.
yeah, you're telling. Yeah, yeah, yeah,
Uh,
yeah, I'm
uh,
listening.
these, these calcified structure are binded, and cavity break this cross linkage of these minerals because of the bacterial encroachment.
Mm-hmm.
And sugar is the prime suspect for it.
Okay.
Uh, Once the cavity has started, it shows as a black discoloration. Initially, there is just a catch, then the black discoloration it become deeper and deeper, and then it goes towards the nerves, and it pain sensitivity are there. So when you see the deep black discoloration, try to get your dentist advice at that time only and get it filled. It will not go deep, and you will not require the more complicated dental treatment like root canal and crowns, and you will not face sensitivity and pain also.
Mm-hmm.
Okay.
Okay.
And white cavities, I suggest again like twice brushing, use of mouthwashes, cut the frequency of sugar intake. That will be more than sufficient if you can do that judiciously continuously.
Okay. 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 So this is the basic routine to cure it.
Yeah, yeah, it is a basic routine. Prevention is better than cure. If something has happened, treat it early. Early you treat,
Yeah.
less complicated treatment you will undergo.
And also, people also have this habit of binge eating. At night actually. When they wake up, when they're awake for the awake for the late night. So what they have this thing that they eat. They actually watch movies and watch shows, and they have this tendency to eat, binge eat in the night. So would you suggest that that is the right? I mean, one can do that, and is it also harmful for teeth?
See, before going to bed, I again stress this thing. Try to do at least a good mouthwash. If not available,
Mm-hmm.
warm saline gargle. Basically, uh, daily it is not advisable, but sometimes you have, and you have to follow this simple precautions. I think this is sufficient to
Okay, I mean, you're
give
saying,
an
okay,
effect.
okay. I mean, whenever you have food or whenever you eat food, it's just that before going to sleep, you just need to brush your teeth
Yeah,
and use a mouthwash.
yeah.
Okay, all right. Okay, so I actually also have got a question. That when a person get a cavity in teeth after cleaning, whether we have an option of keeping white cement or permanent cement, which is better?
See, once the cavity is there, we can restore. Now there are latest material which are available. They are tooth color material.
Okay.
Okay, uh, uh, they are cured by the especially curing frequency light which we use UV light
Mm-hmm.
for curing it, and called composites. And these are currently the best material I feel for restoration. They are tooth colored. They have good strength to sustain. So currently the most advanced material I feel is composite only. Certain conditions, especially in small children, however, we use ionomeric cements also. I personally don't use silver amalgam now in my practice, that
Mm-hmm.
black filling, silver filling. I don't use it now. Um, I prefer more biocompatible material, more aesthetic material, and composite and glass ionomeric cement give me that liberty.
Okay. Okay. All right. So also with this, what are the kind of cases that you're getting in the times of COVID-19? I mean, this Corona time. What are the kind of cases that you're getting? And if you can tell more about it. And also, people are normally taking care of their body, and if they are getting infected with cold, fever, so they are actually getting hyper about it. Too much hyper about it, because a normal cold or a normal cough or a normal pain is actually making them think that they might have got the virus attacked in their body. So they are panicking a lot about their health. So are they also in the same manner coming for the treatment of of teeth. If you can tell something about that.
I think that we ourselves are promoting telemedicine, and we want, and we request patient also that until and unless they have some thing which is very severe, which is called emergency, try to stay at your home. First
Okay.
thing. Secondly, like if you have an exuberant pain and you have to come in current times, we can do treatment, but with all the protection, like I have to wear all the PPE kits, headgears, respirators, all these things, face shields.
Yeah.
Then currently the third molar or very severely decayed teeth, which are grossly infected, we can extract. But as that we drill teeth using our air
Mm-hmm.
rotors, and
Mm-hmm.
sometimes they generate a lot of aerosols. So
Okay.
currently, until and unless it is very essential, we can postpone those things. Orthodontic treatment like braces, like there are many cases which are in pipeline. I am doing because these cases go for months to years. So we are doing those things,
Uh-huh.
but current time, uh, those treatment which we can postpone, we can defer. Definitely, they need to be um, done later stages after a few months. I advise all patients these things.
Mm-hmm.
So aerosol generation is something which currently is not advisable. It's against the moral ethics, and I request patient also. I counsel them that this treatment I think should be postponed for 2 to 3 months. However, we are doing surgical things conservatively. My
Mm-hmm.
orthodontic treatment, I am doing the regular OPDs, prescribing medicines, but the crown part, the cosmetic treatment, basically, they are currently, if at all possible, or until and unless it is very essential, basically, until and unless it's very essential, should not be done.
Okay.
Beside this, COVID time, as we all know, the oral cavity, nasal cavity are the area of interest. Everybody,
Exactly.
because
I was about to ask you that. Yeah.
and it spread to these routes only. So a good oral hygiene is mandatory, essential. If you are
Yeah.
doing that gargles, which I am saying, you can use the betadine also for that. Then you are reducing the chances,
Mm-hmm.
because these agents are effective against, like betadine is quite effective against virus also. So
Okay.
you can do betadine gargles. Yes,
Mm-hmm.
it affect, or you can
Oh.
do warm saline gargles. It is very effective. Like we all do what we can to save ourselves in this pandemic time, which is possible. So first of all, what we can do to save us, and yes, it come under the regular hygiene maintenance procedure.
Okay. And which toothpaste would you suggest?
Basically, I never suggest any toothpaste. I am not wrong brand conscious. You should brush your teeth properly. There is a way up and down motion is there, not horizontal, but an up and down motion. Judiciary brush, change your brush after 6 weeks. It should not be turned out like after 3 or 4 months you are changing when the hair become flat. Once you throw your brush, it should be again nearly soft. It's just like brush. Toothpaste is just like a detergent. Until and unless you wash properly, like detergent is there. Like you just touch and it clean your cloth. Similarly, you have to brush properly. There are many toothpaste available in the market, and you don't need medicated toothpaste until and unless you have any specific dental problem. For regular maintenance, you can use any toothpaste, but you have to brush your teeth properly and change your brush after 6 weeks. That is more important.
Uh, okay. So there is no toothpaste that you would suggest actually.
I told you again, until and unless you have any medical problem, you don't have to go for medicated toothpaste. As you see ads, yes, you have sensitivity, use that toothpaste. If you don't have sensitivity, why are you using that paste?
Mm-hmm.
use normal paste, whatever available in the market, but brush them properly. Use the paste, but brush the teeth properly with paste. Paste is just an
In
agent.
a
Brushing
circular
is
motion.
the,
In a circular motion.
yeah, ah, circular motion. Don't do horizontal like in just 1 minute and just gargle and just yeah, that is done. Don't do the brushing ritual actually. Do it properly, give it time slowly, and then especially that is important. You change your brush after 6 weeks. That is very, very important. I see patients changing their brush after 4 weeks, 4 months, 6 months. That is wrong. Then you are using the best, most expensive toothpaste, and you are not brushing properly. It is of no use.
Yeah. Okay.
Because
Okay.
you are using the best helmet, but then again you are doing rash driving and just putting your head on the stone wall. It can't do anything. So you have to be cautious. Brush, like the dentifrice, we say, the toothpaste, it is just an agent to clean. Main
Okay.
thing is that how you brush.
Okay. Okay.
For
Yeah.
sensitivity,
Yeah.
for
Yeah. Yeah.
sensitivity,
Yeah. I was about to
uh,
ask you about
for, for,
sensitivity. Yeah.
uh, for sensitivity, there are many toothpaste available in the market. You can use them whenever you are using. Start using thrice a day after each meal, but specifically I'll not say all are good. There is nothing like this is the best toothpaste or this is the worst toothpaste. You have to follow the instructions given by your dentist, and use them twice a day. And when you are using them, don't go eat something or don't drink something which is very hot or very cold.
Okay. Okay.
And use at least for 5 minutes so that they can act.
Okay. Okay. And also, when a person is, let's suppose we are having no medicine and we are having nothing, and we suddenly get a pain in our teeth at night, or at a time when we are, when we have no source to reach to the dentist, or we are in the middle of something and we have no source to reach to the dentist. And most of the people, I'm actually getting a question that most, I'll just, firstly, let me just ask my question, then I'll be asking the other question to you. So, we are having no source, actually, we are having no source to reach the dentist, and we are having no source to go get a medicine from the, medical store. So what would you suggest at that time? We are having this very bad pain in our teeth. So what would you suggest at that particular time, that what should we do?
Basically, everybody has some painkiller in their home.
Yeah.
So do a warm saline gargle. If betadine is available, that is good. Otherwise, do a warm saline gargle, and do warm saline gargle, and take the painkiller. Like, even if you don't have painkiller, you have Calpol in your home, paracetamol, plain paracetamol. So it will also work, but that is again a temporary thing, as I say. And this situation arises when you don't fill at appropriate time. You allow it to go deeper to your nerves, because once the bacteria reach near the nerves, then the pain and sensitivity will come in. The teeth will give you proper signs. Before that, you will see, yes, there is a blacking discoloration, but it is not paining. So if you can get the treatment done at early stages, you will not face this scenario.
Okay. Okay. So, doctor, would you suggest any home remedy, or something that is available in the kitchen? If we get a sudden pain or something, so would you suggest something to the?
Like clove you can use, but again I say that for dental treatment, most of the home remedy don't work as work in
Okay.
other things. This is uh, most of the time it doesn't work. Some people use turmeric or clove, but it is not like very effective. It is
Yeah.
just like something is better than nothing. Otherwise, you have to take a proper analgesic, a painkiller. If not available, everybody has paracetamol in their home nowadays. So
Yeah.
you can take that, and yes, you have to reach to your dentist and try to clean the area, maintain the proper hygiene at that time. Do warm saline or betadine gargle. These things are nowadays everybody have there in their homes. At least warm
Okay.
saline gargle, it is very soothing.
Okay. Okay. I also have got one more question. most of the people who gets a tooth pain at the night. Okay, I actually asked you this question. Okay, I have actually asked you the question that I was about to ask you. I actually received the question, but I've already asked you that. All right. So I think I have asked you enough of questions, and you have told a lot of answers. But before going, I just would like to ask a last question to you. In the times of this Corona time, the times of COVID-19, what would you suggest to do and not to do to the common people about the oral hygiene?
See, basically, you have to maintain a good oral hygiene, good nasal hygiene. I'll also say because this is an area which is
Yeah,
closely
like
related.
almost, yeah.
Head and neck it is closely related.
Mm-hmm.
So those who are going out, who are young for the work, they have to take proper precautions. Um, Hand washing, if possible, with soap. Otherwise, use sanitizers properly, like this. This is important. We do like this and go. No, properly between the fingers. Try to have small nails in these time. Then those things which can once you come back to your home, change your clothes,
Mm-hmm.
have clean your face properly with soap for at least 20-30 seconds.
Mm-hmm.
Then when you're out, you're using mask, but you should dispose your mask also very properly. You should just not throw in. You
Okay.
cannot
I
throw your
think,
mask in there. Am I audible?
yeah, you are. Okay.
Uh, Beside this, once these those people who are going out, children and
Mm-hmm.
old people, they should not go out. Whenever
Yeah.
possible, they should confine themselves to your home until unless there is a medical emergency. Those who are going out, if you can take the steam, it's good. It's really good.
Okay.
Warm
Taking
saline
steam.
gargles, betadine, mouthwashes. These are things like they kill bacteria actually.
Okay.
They reduces the
So,
chances of infection by many folds.
okay. Okay.
And if at all you develop some symptoms, don't be panic. Wear mask and because one the thing is that again till now WHO says still that this infection occur because of the droplet infection. Once somebody sneezes or a cough and the droplet which can pass to the area of 2 to 3 feet and you catch them
Mm-hmm.
and you get infected. So if you don't touch unnecessary things and avoid putting your hand on your face, that is very important because
Mm-hmm.
very important. These are things even sometimes subconsciously I do.
Yeah.
I have
Because we are actually
I
habitual.
have,
We have this habit of doing,
avoid this.
putting our
Avoid
hair
this.
and
If you have accidentally done it, just immediately wash your hand, your face. Like you never know where you encounter that virus.
yeah.
But still, 80% of people they are asymptomatic. The rest 20%, those who are
Mm-hmm.
getting are mostly are the people who have suppressed immune system. They have diabetes, they are cancer patient, hypertensive patient, old age patient. But
Mm-hmm.
you can't be sure that say, I am young, so I will not have anything. Yes, I can walk like a
Yeah.
horse without precaution. You need to take precaution.
Yeah.
You can't just take these things lightly. We are seeing many young people getting severely affected nowadays.
Mm-hmm.
So yes, precaution and prevention in our country, which is I'll say a developing country with a lot of population, is only
Mm-hmm.
remedy till now until unless we get some heavenly vaccine.
Okay. Okay.
And once
Yeah.
again, stress this thing that you can use warm saline gargle and steam. These are very effective, very
Okay.
effective.
Very, very effective. Okay. Okay. So audiences and viewers, whoever is watching this show and whoever is going to watch the show later, I would just suggest you to follow the steps that Dr. Chand has told, and that Dr. Chand has advised you to do, warm saline gargle, and all these things that he has told. So if you want your dental hygiene to be good, if you want your oral hygiene to be good, so these are the basic necessary steps that one needs to follow, and needs to keep your smile healthy, your teeth healthy, and also you yourself healthy. Dr. Chand, thank you so much for coming to our show, and pouring us with so much information. And it was so lovely having you on our show, and you actually told a lot of things that a layman would actually ask you. So I actually asked you a couple of questions from the layman's point of view. So thank you so much for coming to our show.
Thank you. Thank you, Rajni.
Yeah, thank you so much. Okay, guys, that's it from Scube TV. We'll be coming to you with another episode very, very soon. Until then, stay tuned and keep on watching Scube TV.